urethra, and it doesn't allow you to urinate. So there are a lot of treatments for prolapse, and again, if it's asymptomatic and minimal, usually there is no treatment necessary. A pessary, which is a simple conservative method, is actually, it comes in many, many different forms, but it can be a ring, it can be actually a square, it can be many different forms, and can help to actually push that prolapse back up into its normal anatomic position, and can definitely improve urinary incontinence and/or retention, whichever it may be. And surgery is also an option for prolapse, hysterectomies, that kind of thing, which can certainly improve all of this. And when someone has prolapse with urinary incontinence, usually the surgery is done in conjunction with the urologist. So, does anybody have any questions? Or should...
Why don't we wait and we'll take questions as part of the panel. So
okay.
You can have a nice seat up top here.
All right.
And we'll go on. Thank you very much for that overview of incontinence, the different types, and a bit of how we evaluate it and treat it. We're going to have our next speaker, Dr. Natalie Barnes, who completed medical school at Louisiana State University and trained in urology at the University of California, San Francisco, and then completed a fellowship in voiding dysfunction in female urology at NYU in New York. Dr. Barnes is in practice here in Boca Raton and Delray, and is a very excellent speaker on urinary incontinence.
Thank you. Is the volume okay for everyone? Okay, thank you. Okay. Push this button right here. I'm going to go back up here. Thanks. We'll turn the volume up in just a moment. So one of the most common questions that I get as a urologist when it comes to the topic of incontinence is as to whether or not they should see their gynecologist or their urologist, because specialists in both fields manage incontinence. A urogynecologist is someone who goes through a gynecology training program and then does extra training or a fellowship in urologic aspects of incontinence. So that's a urogynecologist. And a female urologist kind of comes from the opposite end, and that they go through a urology training program and then do a specialty or a fellowship training in the gynecologic aspect. So a urogynecologist and a female urologist end up doing a lot of the same types of things. So that's one question that I get very commonly. A lot of the topics that I'm going to discuss tonight, Dr. Stern has already covered very thoroughly and very well, so I apologize if there's a lot of redundancy in our talks, but to try and just go over the highlights. I'm struggling.
Here comes Bernie.
Again, if you could turn it up a little bit more. The definition of urinary incontinence is the involuntary loss of urine. Common misconceptions that I hear very frequently is that people do not come to their physicians asking for treatment because they think that their only choices are drugs, which they've been told have many side effects, or surgeries, which many people think that they're too old for. And I can't disagree with that more. There are plenty of people in their 80s who have had such severe incontinence, or even in their 90s, who've had such severe incontinence that they have ended up having to go through all of the normal, easier procedures that we've talked about, but can end up having to have surgery. And what I always tell my patients is that it's most important. What's most important about incontinence is that it depends on how much it bothers the patient, because again, it's not necessarily a health risk. It's more of a quality of life issue. But nonetheless, if it's bothering the patient enough to where they come to see a physician in the first place, then there are definitely many options available, and we'll start with the easiest and proceed to the a little more difficult and proceed on to the more invasive things such as surgeries and things that people really try to avoid. And we know that people don't want to come and have surgery if they don't absolutely have to. But again, if it's affecting them enough, most people will go through with it. But again, it's always the patient's decision. And again, it's not a normal process of aging. It happens in children. It happens